mystical, magical, trees offer us a connection to our spirituality. In the African savannas, the tree of life is the baobab, a majestic symbol of life that can live up to 500 years. In the Jewish faith, it is known as the Eitz Chaim. To the ancient Celts, no tree was more sacred than the oak, whose deep roots penetrate and ground us, and whose branches soar to the sky. The tree of life has many incantations, but universal meaning. The tree of life is the symbol of our silver anniversary. Because of your generosity, the Foundation for Thomas Health is transforming the patient experience at Thomas Memorial and St. Francis hospitals. Contributions to the foundation are deployed on multiple fronts. Few as cute as this. Pediatric patients like Madeline now drive themselves to surgery. What Madeline doesn't know is that a registered nurse is using a remote control to operate the vehicle.
This allows us to take the child away from the parent for the procedure without crying, without shouting, without screaming, which makes for a much more pleasant experience for the parents, the patients, and us.
Little ones who take a ride in this car are relaxed and require less medication when they arrive for surgery. As a result, they get to go home sooner. Your gifts are deeply rooted in our hospitals. Funds from the foundation are invested in staff by supporting educational advancement, training, and continuing education.
When we have the foundation supporting educational activities of our employees and their children, that benefits us all as a group.
The foundation is like the giving tree, cultivating relationships that produce meaningful results. Dr. Mark Hatfield is the founder of Retina Consultants. His practice helps patients with complex eye problems.
I woke up the morning and I was blind, I would have to say. I could not see anything. No, it was completely black, not light, absolutely nothing.
Working collaboratively, Dr. Hatfield and the foundation focus on sight-saving measures. Thanks to donor support, the foundation purchased equipment that's used in eye surgeries at St. Francis Hospital. That equipment helped restore Sonia Armstrong's vision.
That was excellent work that was done so that I could have the proper vision, not having to worry about my sight and losing my sight or anything like that. That you cannot put any price on that or to say what that means, to be able to see.
Our cost of our equipment in ophthalmology is exceedingly expensive, exceedingly technical. I'm very grateful to the foundation to help provide the spark to get the equipment necessary for sight-saving procedures for people. And I think those services will only grow in years ahead. There's just a tremendous need for these services.
It's bittersweet because I always say I wish we had a healthier population here, but we don't. But I'm thankful that we serve all these communities in West Virginia and do it locally so people don't have to travel.
Like the foundation, Misty McLaughlin is branching out to help others. Misty overcame her drug dependency and now works as a recovery coach with Pregnancy Connections, a program supported by the foundation.
That's what's so amazing about this position, is that I get to see all the time women come in with their babies and women transform into the mothers that they're supposed to be and the best version of themselves, and start to see that the lie is dead. People do recover.
Tiffany Mitchell is one of those. Pregnancy Connections gave her the support she needed to stop using heroin and prepare for the birth of her daughter, Kiera. The continued support and education empowers Tiffany to be an active parent in her daughter's life.
I'm very thankful for Pregnancy Connections. I wouldn't be where I am today if it wasn't for them. I mean, honestly, I wouldn't be. If I never reached out to this program, I don't know where I'd be. I'd probably still be a mother of 3 kids struggling with addiction, not being a full mom like I am today, really being in their lives. Like the little things, going to the movies, going out to dinner, things I never got to do before.
While Tiffany's daughter is doing well, there are many other infants battling addiction due to maternal drug abuse. Because of that, the NICU at Thomas Memorial Hospital has become overcrowded.
Of that specific population, about 65% of the infants in the NICU are drug exposed and suffering from neonatal abstinence syndrome. So they have that special classic set of symptoms of excessive cry, vomiting, diarrhea, sneezing, no sleep.
To help soothe the babies, the foundation purchased specialized rocking chairs. Volunteers like Lisa Dunderville provide some extra TLC.
It's only when you're rocking them, loving on them, that you feel the tremors and those sort of things that indicate that they're pretty sick.
Currently, the neonatal abstinence syndrome, or NAS babies, are cared for in the NICU. But that bright, noisy environment is not ideal.
These babies require a dark, quiet space because of the drugs that are affecting their nervous system. So the dark, quiet environment really helps the baby just be able to rest quietly and get through the symptoms a lot easier.
The foundation is working to finance a new, separate nursing unit to care for these innocent and precious babies. The need is overwhelming.
This crisis is real. This is an epidemic, and we have to react and we have to do something. The NICU environment is not going to work forever. We have to do something. We have to have a specialized environment so we can provide the best care for the infant and give the education to the family.
Your donations will literally plant the seeds and nurture some of our most vulnerable.
It is so important for people to get involved and to help. I just think it is our responsibility as fellow human beings, whether you can give with your time, whether you can give with your talents, or whether you can give with your money. That is what we as human beings with the least bit of heart should do for each other.
It's been said that the true meaning of life is to plant trees under whose shade you do not expect to sit. That is our calling.